Good day, everyone, and welcome to this webinar entitled Breaking Through the Barriers to Comprehensive Wellness, Simple Solutions for Payers and Providers, sponsored by Eureka and Salesforce. My name is Mark Hagland. I'm Editor-in-Chief of Healthcare Innovation Magazine. Before we begin in earnest, I just want to share a few housekeeping details with you. This is regarding how you can ask for help. Excuse me. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, it's my pleasure to welcome our speakers, Dan Bergner and Tony McCune. I would like to have them introduce themselves briefly and tell us about themselves, and then we can launch into the program itself. Dan and Tony, welcome.
Thanks, Mark. Really appreciate it. Excited to be here today. And I think if we've got a slide or we want to queue up here, we can get rolling on that. But my name's Dan Bergner. I'm the founder and chief product officer of Eureka. Spent the last 2 decades building service-oriented software. And really my first dive into population health management software probably kicked in right around 2010 with the emergence of the Affordable Care Act, which drove a lot of new care models. So spent a little bit of time doing things like population stratification, using big data sets to assess cohorts, building mobile decision support systems for new care models happening outside the 4 walls, and also care management applications. It was driving like continuity of care across collaborative care teams. And that led me to an opportunity to focus on Eureka. And Eureka really is a no-code platform for guided omni-channel service interactions. So tools for mobile workers, call center agents, and consumers to be guided through end-to-end service interactions. Like I said, excited to be here. Glad to be joined by Tony at Synaptic, one of our great partners. Tony.
Hey, good morning. And Mark, thank you. And Dan, appreciate the invitation to join today. Looking forward to the conversation. My name is Tony McCune. I'm the Senior Vice President of Industries and Go-to-Market here at Synaptic Advisors. And we're really focused around healthcare. That's core to our business model and supporting payer and provider organizations using Salesforce, Health Cloud, and the Eureka product. And excited about kind of talking about how we can take that a step further. I've got a background with Salesforce for the last 17 years and really a very deep focus on some of the same things that Dan described here for the last 6 years in the healthcare practice. So look forward to having the conversation.
Wonderful. Dan and Tony, thank you so much for introducing yourselves. Well, let's plunge in. Tell us a little bit about your experience that have led you to insights on the concept of comprehensive wellness. Whoever would like to begin.
Sure. Yeah, I can kick us off. So just to set the stage, Tony and I, our teams have had opportunities to collaborate on a couple of pretty cool projects over the last few years. It was one of the main reasons I asked Tony to join. But the first one I'll start with is a pretty unique experience that we had over the last 3 years. And it was a project doing COVID disease surveillance for the UK. And it was something that we started in 2020, where we were working with a couple of partners to essentially, in its first state, deploy about 7,000 mobile study workers across the UK with the goal of conducting in-home tests in addition to health assessments. And it started to achieve some pretty amazing volumes. I think we were at clips of 15,000 health assessments per day. There were hundreds of data points being validated at each visit. And the whole goal was really to produce a consistent, comprehensive picture of wellness or the state of the COVID disease across the UK. So we were working to collect and aggregate the summaries of how COVID was impacting the lives and the households in the UK. And it was producing data and analysis essentially for Boris Johnson to report on the state of COVID in the UK. One of the unique challenges to that program, which we're all familiar with in our own ways, is the constantly evolving guidelines and needing to be able to change and adapt, update those guidelines, and make sure that the study workers that were in the field were following the latest and greatest guidelines on a daily and weekly basis. So I think back to our own experience here in the US. I just remember frequently checking CDC guidelines on their website and how often they were updating. And, you know, as things evolved and started to settle across the globe and specifically in the UK, that program evolved and it shifted from individuals, again, going household to households, doing these in-home assessments to something that was available for each individual resident to administer their own assessment, much like a patient portal almost, where you'd log in, be able to administer or complete your own assessment, in addition to making a telephonic version of that assessment available. So it was a really eye-opening experience for me to see how we could shift from, you know, clinical guidelines, if you will, in the hands of a clinician to actually being in the hands of a healthcare consumer. And I say consumer not to, you know, commercialize the concept, but really just more so it's different whether you're a payer or provider thinking about members or patients. So in general, just the healthcare consumer was able to have access to these assessments in a matter of days. And we were able to keep that very adaptive state intact with that transition. So now we found ourselves in a state where when we were updating our guidelines and our protocol that were memorialized in these assessments, it wasn't just going to study workers that were working on behalf of the program, but those same guidelines are being made available to the call center agents doing these telephonic assessments, and even into the hands of the direct healthcare consumer doing their own self-administered version of the assessment. So for me, that was this really positive takeaway from the pandemic. The eye-opening moment for me was like, this is omni-channel health service. And I think there's a really great opportunity for us to carry that forward and make the most of it.
That's a really interesting experience, and I'm glad it turned out so well for you, Dan. Sure. Tony, do you have an experience that you'd like to share that's comparable?
Yeah, absolutely. Love to. And while Dan and I were working together on this kind of very interesting program to do the COVID surveillance, we were also struggling through and kind of building out a really different model for a payer organization. So we started working together with Eureka, Synaptic, and Salesforce on a solution for one of the largest payers here in the US, which was a focus on their transformation of their Medicare, Medicaid Advantage health risk assessment, which had, you know, as we know, is mandated for them to do, but you know, they were struggling through how to modernize that. And so, I mean, they had a couple big priorities. One of them was to really address the challenges of data collection in the field. They've got members out in homes, rural areas, spread all over all 50 states that they were supporting. And so they wanted to make sure that they could address improving their data collection process and data accuracy the members' experience, the clinicians, the nurse practitioners in the field's experience. So that was kind of priority one. And then the second priority was really garnering as much intelligence about the well-being of every member, and exploring areas of their health and wellness, including, gathering more detail around their medications, their allergies, their gaps in care, and their previously identified conditions, making sure those were validated and confirmed. So those two problems kind of all led through to what becomes the back end problem, which is all that has to flow through to clinical coding and make sure that data flows back to the government for proper credit for their member population, as well as them just being able to do the detailed analytics that they wanted to be able to do. And there was really about four major obstacles that they ran into, that they were battling. First of all, as I mentioned, it's a distributed population. So their members, you can imagine, some of them may be rural Kansas, spotty internet or non-existent internet. So relying on a strictly connected solution was risky. And so they would address that with kind of offline capabilities that really constituted notepads and paper or spreadsheets. And then, the nurse practitioners would end up going home and redoing the whole assessment back into a system online. And so you can imagine not only the frustration that poses, but also one of the, byproducts that unfortunately is just having errors and omissions and things that happen during the transposing of that data back into systems. One of the other challenges they had is a lot of these NPs and clinicians in the field were actually contract workers and seasonal workers. And so they didn't have as much skilled experience in the protocols and processes of those assessments. So things were often, challenging, things were missed, and so the coding team would be sending stuff back saying, hey, you missed this, or you missed that, this information is not clear. So dealing with that, and then, kind of moving down a little bit further, they really didn't have the insight. And this is where they wanted to go one step further than just data collection. But they wanted to be able to look at, based on this member's history, what questions should we be asking to help us understand more about their previous conditions and how that might affect, their future care plans, right? And so part of that is like, how do we push data into the assessment that helps us do guided questionnaires and kind of asking the right questions at the right time, being able to avoid questions that are relevant, right? Gender specific things or so forth. And so using that data in the assessment allowed us to do intelligent routing of the forms. And then the last problem was really this idea that all the coding that has to happen post-assessment, it was pretty laborious, and there was a lot of back and forth. And so we introduced some intelligent insights or discoveries, as Eureka calls them, that lets us look at a rules-based approach to evaluating the responses and identify what we call candidate conditions. So we're not trying to replace the coder's job, but we're trying to make their job more streamlined. So we were able to do that, and then even attach the appropriate ICD-10 codes to that. So all of that was, kind of culminated in being able to address all of those concerns in a single platform with Health Cloud plus Eureka in the field. So that example, I think, is really stands out for me.
Both of those are great case studies, gentlemen. I think they're really interesting. The things you learned and, the deficits that were in the field, such as you just referenced, Tony, the problems in doing this well. So given all that, how prevalent now are health assessments, and where are they being used across the healthcare system? And I'm particularly interested in how the barriers that both of you mentioned, some of the obstacles, how that affects the prevalence of the use of health assessments and where they're being used. Whoever would like to. answer. Tony,
I'll,
go ahead.
I'll take that one if you don't mind, Dan. So I'll jump into that. Thanks, Mark. I mean, I think one of the interesting questions that I ask is like, how do we define what an assessment is? And when we think about it traditionally, like the payer example, that was pretty defined. It's mandated. There's certain questions that have to happen, and we have that given to us by Health and Human Services. We know what questions we need to ask, right? So that's a defined assessment. But if we think about it a little bit more broadly, assessments are, anytime we have an encounter with a patient where we need to gather data in the right time and the right place. And Dan sort of alluded to the omni-channel component of that, and I'd like to come back to that a little bit later. But some of the more typical places that we see assessments happening, in-home assessments where we talk about the clinicians, as well as like caregivers. You can think about gathering data even in more chronic care, palliative and hospice scenarios as well. But then you've also got like the payer example I gave. But then we can think a little bit more broadly about it in terms of, for example, first responders doing trauma assessments, because once we introduce these intelligent capabilities, we can introduce other media into the assessment, such as taking a picture and using Einstein to compare photos for us, to give us some insights, and it doesn't replace the clinician, but it augments the information the clinician has available to them. And then I think about like study participation. The example Dan gave, I think we touched on average about 250,000 participants a month towards the end of that study. So those were participants in self-service portal or Experience Cloud on Health Cloud. And then, probably the last example comes to mind is maybe employee wellness programs. So we could actually be using that. I on my watch, I have all kinds of telematics that tell me if I'm, getting certain data, but if I combine that with questions that help me understand my diet and choices I made today, all that information allows us to make much more thoughtful decisions. So
I'm sorry, I didn't want to interrupt you. I just said
no,
yes. Go ahead.
I could go on for quite a long time, but probably we should throw the ball at Dan. I mean, the payer example we already had was really focused around the ability to do some interesting things with gaps in care, conditions, monitoring medications, allergies, all of that. So it becomes a powerful tool when we start adding that plus the data we already have and some intelligent rules we can apply as we do the data gathering. So.
Yeah, Dan, please add your additional insights. I really liked the way Tony framed this and shared like the different settings and where some of the challenges are to this.
Yeah, absolutely. I think there are lots of places that assessments are unfolding across the healthcare system today. And one of the things that Tony and I've talked about in the past is just there's the net of all of this, right? Like one of the major insights being like health assessments tend to be overlooked, but they're much more powerful, I think, than people tend to initially assume, especially with some of the more advanced softwares for facilitating assessments today. But I think for me, it's really kind of this call to the healthcare system to start to standardize and make these things readily available to an individual. To Tony's point around like employee wellness, there's certain tools that are made available to a member from a payer, right? But then you start to think about all of the tools and assessments, if you will, that you have available to you as an employee of an organization. At any given moment, I'm experiencing things like performance reviews. I can go do a self-assessment of how I'm doing relative to my KPIs, some sort of weather vane that indicates how I'm doing as an employee, right? And that type of tooling, those types of self-administered assessments, it's hard to come across a standardized place to access those things, to understand how I'm doing in terms of perhaps I'm managing a chronic condition like CHF, or I'm trying to get a hold of, my mental health or something, and I'm trying to manage through those things and monitor them over a period of time. It's difficult to come across those types of tools today. And I don't think they're terribly hard for us to produce. It's more of a call to start to standardize and make those things readily accessible in kind of this omni-channel theme that Tony and I'll continue to elaborate on here.
Yeah, I think that makes total sense, Dan. I'd love to ask you both, what are the kind of stumbles that you're seeing in the industry where an organization may not be they may not be concepting or framing correctly. They may not be executing correctly. As you mentioned, Tony, sometimes the individuals who are charged with executing the assessments may not be ideal for the purpose. What are kind of the stumbles and problems that you're seeing out in the field? And obviously, I know you won't name individual organizations, but what types of organizations and what types of stumbles?
Sure. So I think take a swing at this in a pretty general sense, right? So I'd say a consistent challenge that we're seeing, right? Let's start with a pretty macro concept, right? Of even outside of the healthcare industry, right? So many industries are thinking about succession planning, right? We've all heard the staggering statistics of how millennials and Gen Zs can't replace the entirety of the baby boomer workforce that's out there that is preparing to retire. And I think one of the really impactful elements to that, especially inside of the healthcare industry, is there's so much knowledge and expertise in the brains of those individuals across the workforce today. So a common question that we experience across many of our customers, right, is they're trying to solve the problem of, how do I essentially create a bunch of experts overnight? Where is all of that knowledge going to come from? And so we think about this as, in general, like a broader succession planning issue that needs to be addressed. So, back to Tony's point around his payer case study that he was highlighting, it's not only like backfilling new hires, but there's also this big swing to more and more of this work being shifted to third-party organizations. And with both new employees and new contractors, how do we ensure, consistent, optimized level of care and interactions with our healthcare consumers? And the neat thing is, inside of the healthcare industry, there's this really cool superpower where not every other industry has the opportunity to take advantage of research-based evidence that supports decision-making, right? So a really simple example of this is, like a PHQ-9, a really simple assessment of depression, right? This is fundamentally a tool that upskills anybody who has that assessment in their hands, whether it's, Tony on the other end of the phone, or a web session, or a clinician in an office, or me sitting, at my house doing an assessment for myself. So I think about this amazing opportunity to solve this really large problem around upskilling an entire workforce, whether they are new hires or contractors, through simple tools like assessments. And we got to take advantage of the fact that there's so much research-based evidence that can memorialize how we make decisions around providing care. And I think that's the pathway to the next generation of clinical care here. And Last point on this is it's important to start doing these things now and not wait for everybody to start to leave the workforce before we try and solve the problem. Because with the right tools and process in place, we could be learning from all of those interactions of these seasoned industry veterans, these clinical experts using these tools, and start to incorporate all of those learnings so that we're really hardening a tool for the next generation of caregivers. And, in general, right, it's this, these encounters that we're having with organizations that are really just trying to spread knowledge, upskill an entire workforce. And like I said before, right, the pinnacle of like achieving optimized, consistent care. And I think assessments are a simple tool that can get you there that tend to be overlooked.
Yeah, wonderful. I really like the way you frame that, Dan. Tony, would you like to share about stumbles and challenges?
Yeah, absolutely. And I was just thinking about that. We won't make any boomer jokes, Dan, whatsoever, since I'm on the call here. But I love the upskilling point. The other thing that kind of comes to me, and this is where we have a lot of conversations with organizations in the payer and probably even more so in the provider space, where let's kind of realize that COVID had a dramatic impact on how we do patient engagement from 3-4 years ago to today. And, whereas there was a whole argument about telehealth and adoption outside the four walls of the healthcare facility today, a lot of healthcare is being delivered outside those four walls, and that distributed care model, if we look at time, COVID actually significantly compressed the transition model that happened, and technology, I think, frankly, is struggling to catch up. And the thinking also has to catch up with it, Mark. So the idea that we have, this centralized on-prem system that is highly secure and very well thought out, that doesn't fit into this paradigm where we are looking for ways to do telemedicine, potentially self-service patient portals. We've already talked about some of the use cases where we're pushing engagement out into the field with, with mobile devices on the persons of people who are doing, trauma, point of care, emergency services, all that. So we start to see also this difference of mindset amongst the patient consumer, whereas pre-COVID, some of the people with gray hair like myself might have been reluctant to engage in telehealth. They were pushed through that barrier by force, right? And so that just opened up their willingness to do that. So renewing prescriptions through their patient portal, doing things like that have become acceptable practices. But at the same time, some of those original delivery model platforms really weren't designed and aren't designed for distributed engagement models. And that's where you think about Salesforce and these assessment concepts that we're talking about right now come into play. So how do we address that? Like, really what we're talking about here is omni-channel engagement. We hear that buzzword quite often, but how can I engage a patient or member with assessments, and maybe I'm asking them when they call in to the support line and I'm walking them through the upskilled, intelligent routed questions Dan just talked about to gather information. Or maybe I'm doing that in a patient portal where I'm actually guiding them through the assessment. They may not realize they're being guided, but we're guiding them through the right questions. That sort of omni-channel engagement doesn't work if we think I'm going to create a bespoke solution for mobile and I'm going to create a bespoke solution for patient portal, and let's stand up, a call center app that stands over here. All of those things really need to work on one operating model and one infrastructure to really bring all that back together. And that's where I think the power of the combination of Health Cloud with Eureka, and in some cases, integration tools like MuleSoft allow us to have a single system of engagement with omni-channel methods or modes of engagement that happens. And I think that's kind of where we're headed, over the next few years. And I'm pretty excited about, being part of it.
I appreciate that very much, Tony. And I really appreciate how both of you have kind of framed what the challenges are, because I think they're definitely approachable. There are a lot of things that organizations can do. And for that, let's talk about the potential impact. What is our horizon here? What's the potential impact on the industry in successfully deploying assessments? Maybe we'll start with you this time, Dan.
Yeah, you bet. So when we start to think about like the impact that this could have here, it is, in my mind, we talked about this concept of upskilling, right? And I think the net of all of it becomes consistent, optimized care that's being provided in a fully omni-channel state, right? Like we see on the screen, I'm having a very consistent experience. And as a clinician, I even have access to information creating this picture of comprehensive wellness, whether it was an assessment that was completed last time I was in the office, or through telehealth, or maybe something that I've done under my own efforts going into a self-service portal, right? And that really helps drive to a state of creating consistent outcomes and a full picture of wellness around an individual, depending on how many different varieties of assessments you start to conduct across those different settings or make available across those different channels. And like I said, if we're harnessing the knowledge that exists across the clinical workforce today, it's just going to further improve the efficacy of all of those assessments that we deploy in the market. So when I start to think about, bringing all of this together and what does it start to look like, Tony talked about the different channels in which healthcare can be provided in-home, at office, remote, and self-service. We covered how assessments could surface potential diagnoses, like in that payer example, where it's even sourcing potential ICD-10 codes and suggesting intervention strategies, maybe without a formal diagnosis in place. So I think, if you're anywhere across the healthcare system, a regional hospital system, a payer, a population health focused entity, maybe even a primary care physician, whatever form you are, providing an omni-channel healthcare service should generally have like a few key characteristics, right? So Tony touched on this idea of like centralized decision support, right, for clinicians and consumers to leverage, centralized recording of each interaction with those tools and assessments. And then, lastly, one of the big things I think is the ability to learn from each of those interactions. And like I was highlighting during our COVID use case, easily making improvements based on the insights and feedback from those leveraging the tools and assessments in the market. And when I say easily, we're talking about drag and drop, no code solutions that are surfacing insights. The system is telling you, here's a region we should make a change, and here's the supporting evidence for making that change, so that a human is now being augmented by a machine to make an improvement to the process. And, this is where folks like Salesforce, Eureka, and the folks at like Synaptic are able to come together and actually deliver these types of solutions to the market.
Terrific. Tony, would you like to add anything or respond to anything Dan just said?
Yeah, I mean, I think what's like Dan sort of is alluding to it, but I often get asked the question, is this hard to do? And the answer is, I mean, it's not hard to do if we kind of approach it in the right way. And I look at kind of where Salesforce is and the Eureka tool sat, and so where we've kind of rolled this out very quickly and successfully. We're talking weeks, and then sometimes, once we get the infrastructure in place, it's days to roll out new assessments, and we are able to sort of leverage using a CRM as because essentially engagement is it's the core DNA of what a CRM tool like Salesforce does out there in the marketplace. And so kind of using that capability and then layering on that as the conduit and the assessment tool, using the standardized way of just drag and drop building out forms, and knowing that we have kind of that rules engine there, and we still can connect it to our EHR data model. And we know that once we get that consumed back in, we're still able to interact with it in a traditional healthcare model, but we don't necessarily need to re-engineer our healthcare system to accommodate this. The pendulum between best and breed and everything, on one platform, that pendulum just keeps swinging. And I do think that in healthcare, there's been a real tipping point to move. We mentioned COVID being a driving force. I think also some of the newer technologies, maybe we'll talk about this in a moment, but some of the generative tools and things like that are creating this moment of tipping point in healthcare delivery that I think is very applicable right now. And we need to be able to start thinking more about, what are these tools that we can use that we can move very quickly, but yet, leverage what we've currently got. And that's where, I look at the combination of Eureka, Salesforce, and then some of the integration standards that are now becoming very commonplace in the market. Salesforce supports a lot of predefined, integrations with MuleSoft, for example, that we don't have to reinvent that as we move forward. So those are I don't think it's as hard as we want to make it. We just have to be okay with getting outside of our traditional clinical platform mindset when we do it.
Yeah, wonderful. And yes, Tony, you are psychic. I am going to ask about emerging technologies in a moment, but let's hold off for just 1 second on that. So here's my question, gentlemen. How does all this come together to help the healthcare system achieve a really comprehensive view of consumer wellness? And whoever would like to leap in first.
Sure. Yeah. And I think, Mark, we're touching on a couple of the pieces here, right? So, I was sharing some of the characteristics that I think the healthcare system can be looking for in these types of solutions, right? So obviously, I think we're pretty clear at this point on the importance of it being omni-channel, having a method of easily deploying these types of solutions, learning from them. And to Tony's last point there, like a lot of these tools exist outside of traditional clinical tool sets, right? So we're talking a good bit about a lot of like the Salesforce toolkit that exists in order to integrate with traditional EHRs, practice management systems, or the data lakes that may exist inside of a payer environment, and extend all of that to create this optimized healthcare consumer experience. And it doesn't need to be terribly difficult to go deliver, to have a starting point delivering this type of healthcare consumer omni-channel experience. And like Tony said, this can be something that stood up in a matter of weeks to get a program like this running in a new environment.
Wonderful. Tony, anything to add to that?
Yeah, I mean, that's spot on. I think the key there is that if we reuse some of these capabilities and start focusing on using the tool set in a repeatable fashion, then it just becomes exponentially faster. And I've seen that in play a number of times now, including, the example Dan talked about with COVID surveillance. We literally transitioned that engagement from the study worker to a call center to self-service and a hybrid across those two things, all a matter of weeks each time we made that iteration. And I think the core was the foundation was always the same. So,
yeah. Is it particularly challenging, John, to stand up these different types of omni-channel solutions? Is that, you had alluded to it briefly, Tony, but what are both of your thoughts on that?
So I can touch on it a little bit more, I guess, and expand on that point. But it's not terribly difficult to do that because, for example, the tool set and the method we took here together with Eureka, the same assessment tool set is deployable to a mobile platform as well as a web platform. And then we just simply took the web platform and we optimized the user experience for flow for a call center, patient engagement center scenario versus the same exact assessment was being pushed out to their patient or their study participant portal. So we were able to just do a lot of reuse. And then whenever we made modifications like protocol changes, we had to support multilingual situations, stuff like that. We handled that with a core assessment tool set, and we just deployed it to those different delivery models. So it was very quick.
Okay, wonderful. Any additional comment, Dan?
I guess the only other thing I'd add is, a lot of organizations, I think at this point are a bit weary of going down one of these paths, worried about how complex the project may be, how hard it may be to implement. I think to the question earlier, and what we're finding at this point is that folks like organizations like Synaptic have a repeatable process that's pretty dialed in, low touch, but very configured to a customer's specific needs that allow folks to get up and running with the assemblance of, I think, a relatively lightweight project team on the payer or provider side. So, just going back to, there's a lot of white glove turnkey solutions that are out there that can help folks achieve this optimized state.
Wonderful. And my last question, and you were very psychic, Tony, in anticipating it, is how will AI, the emergence of AI, impact this sector? Tony, you, and then Dan.
Oh man, I think that's definitely Dan's domain as a technologist. But I'll comment and just say I'm kind of excited to see the option to potentially use some of the outputs of these assessments to seed into generative AI solutions. But I think one of the concerns I have, and I think many people have, is just the idea of how do we make sure that doesn't turn into clinical self-diagnosis problems. So I'll throw the ball at Dan on that, though, because I think he's got a lot more thought.
Yeah, sure. And Tony, I think that's pretty spot on, and like where there's a lot of concern in the market today, right? So there's been a lot of AI around healthcare for quite some time now, right? I think like one of the earliest instances we all saw was, the common example of someone takes a picture of a blemish on a skin and image recognition comes back and maybe makes some sort of suggestion like, hey, you should probably go see a dermatologist, or, continue to monitor, nothing alarming at the moment. But I think what we've all experienced over the last couple of months around the emergence of generative AI and large language models coming into our daily lives is pretty disruptive, right? So tons of valid opinions around where generative AI will take the market. My quick take is, I think about like what we have on the screen now, right? Traditional internet searches, they're less than ideal. The results are often full of clickbait, misleading guidance. And, search engines are working to eliminate the prevalence of those types of results, but there's still things that get through, like even malicious content, which isn't a terribly large deal if my search is, what are the most comfortable socks on the market today? But very different if I'm trying to figure out or diagnose whether or not I'm experiencing symptoms of a stroke. So like what we're seeing on the screen at the moment, and it's obviously a little bit of a leading start to a search to emphasize the point, right? But like consumers want initial answers to clinical questions without interacting with a clinician, whether we like it or not. It's what's happening. You can see like the predictive search top 10 results are all clinical. And, I think the beauty of generative AI, chat GPT generally dominating the conversation at the moment, is it cuts through all the noise and can give you direct guidance as a consumer, direct healthcare guidance as a consumer. And I think it leaves us in a spot, Tony's point, where like the accuracy of the guidance is really what's in question here. So if we roll to the next slide here, I'll just give you a little bit of a backstory, and it's not meant to be like fully legible here, but like quick example, I have 3 daughters. We've had our fair share of injuries in our household. My wife's been a nurse at the local hospital for the last 2 decades. So we've got a little bit of a foundation on how to treat minor injuries in our house. But, we were getting ready to leave for vacation. My daughter injured her foot. And I, after I made sure she was in, an okay state and we had done the things that we thought we were supposed to do, I was like, hey, I should run this through, chat GPT in this example and see what sort of results come back. And without all of the advertisements layered in, links to other sites that could distract me or steer me away from the actual clinical guidance that I need, I get this really well succinct and curated feedback on the left-hand side, what are the symptoms of a broken toe in this example? And then on the right-hand side, how might I actually treat this? And we can, not without getting into the clinical debate over the accuracy of what's being provided here, like it or not, what's really interesting about this is it strikes a balance across all of the unique attributes that you might find on really popular sites today that most of us use in order to go do kind of our traditional clinical searches in trusted locations. And after evaluating several sites, what I found was, hey, this could, if I believed in the clinical accuracy of this, it has aggregated unique results into one single interaction for me. So it would eliminate, the possibility presents itself to eliminate the searching that you might do where you check, maybe the site of one clinical site, and then you go to another one and you're looking for unique differences. This is going to create a really streamlined collection of guidance for a healthcare consumer. So, I think that said, with the convenience of these types of tools, right? Our job, I think, as a healthcare system is, curating and harnessing these interactions, especially given the potential severity of the implications of the guidance, right? So here, I've purposefully selected something that is, if someone has a broken toe, generally they're going to be okay. But like I was saying earlier, if someone's searching for, hey, what are the symptoms of a stroke? It carries a different level of weight to it. So I think we can leverage these types of tools to build assessments and even assemble protocol that help us address certain diagnoses. But the emphasis is really on the data that's used to train these generative models. And it's scary when you think about clinical guidance coming from something that just has unfettered access to the internet, but it can be trained by a trusted organization's clinical data set, and without question is going to shake up healthcare consumption. If we think back to that omni-channel visual, right, where you have self-service models, a lot of that today happens in a patient portal, sometimes through a chat bot. Then it's just open web searches that are unfolding. And what we're going to find is these generative AI interfaces are going to become a new form of, or already are, a new form of self-service healthcare. So consumers are clearly demanding it. I think we're deserving of this type of convenient care. But as a healthcare system, we have an obvious responsibility to make the models as clinically accurate as possible.
Wonderfully said. Thank you so much, Dan. We have just enough time. We have one question from the audience, which I would like to share with you, and then we'll be able to allow you gentlemen to summarize any last thoughts. How does that sound?
Sounds great.
Sounds great.
Okay. Thank you. So one of the audience members asks, is there a strategy for addressing health equity for undocumented residents as a population for healthcare assessments?
Sure. I won't open the box around maybe necessarily documented versus undocumented access to care, but I think the things that Tony and I are talking about here, right, lends itself to, I think, broader access of care, right? So when I think about, especially like in the self-service domain, right, like a lot of the tooling that we're talking about here doesn't necessarily require some form of authentication or membership to a particular payer's plan. It doesn't have to anyways. Certainly in the ChatGPT example, it does not, but I think the goal and what we're strong advocates for here is making this really comprehensive, standardized practice of care available across many different domains, and ideally could be, very personalized, as Tony was talking about in the payer example with the annual health assessments, right? It's taking every aspect of my life, all of my domains into consideration and tailoring that assessment into areas that need further exploration, perhaps even without me being aware of that, as someone who's self-administering or conducting an assessment on behalf of a member. So I think end goal we love to see unfold is, really consistent, optimized care available across many channels, ideally available to all.
Sounds great. Do you have any quick thought on that, Tony? Oh, you know what? I'll kind of go very tactical on it for a second and just say, we addressed some similar challenges with the COVID study we talked about earlier, which really, we addressed it in a couple ways with anonymized data gathering. And also, one of the we didn't deep dive into capabilities of tools here, but the ability to do translated assessments and be able to offer, multilingual delivery on demand based on, locale or language preference. So being able to optimize at least to have consistent interaction and then pulling that data through in an anonymized way is definitely kind of, I think, part of that strategy.
Wonderful. Thank you both for answering that. We literally just have a few minutes left, so I would like to ask both of you if you'd like to share any last thoughts, including any advice.
Sure. Yeah, I think both Tony and I love having these types of conversations, and have had, I think, we highlighted 2 examples here today, but we've had numerous different experiences across the entirety of the health system, even blending over into the life sciences and clinical research space. So as we had kind of the links to our bios or ways to reach out on the last slide there, please feel free to reach out. We're happy to talk about, either vision, direction, or if this is resonating with, a program that you're working on at the moment, tactically, how we can collectively help you successfully launch a program to achieve omni-channel care.
Wonderful. Any last thoughts, Tony?
Hey, Mark, thank you so much for hosting this, and I appreciate your time, and Dan as well for including us. I could pontificate about this topic all day long because it's something I'm very passionate about. But as Dan said, feel free to reach out. Our information's there. One parting thought I would encourage everybody who's listening, just, if you want to do this and do it right, I think you want to kind of take off some of the pre-assumptions and begin with the end in mind. What do we want to accomplish? Set some of those goals, and then I think there's some interesting ways to get there without using perhaps pre-assumed strategies. And so I'd love to talk more about that.
Wonderful. Well, thank you both so much. Thank you to our friends at Eureka Salesforce, and thank you, Tony, for representing Synaptic Advisors here today. So that's all the time we have for today. I want to thank you both, Dan and Tony, for the excellent webinar. And again, to the folks at Eureka Salesforce for making today's program possible. And finally, I want to thank everyone in our audience for joining us. We hope you'll join us again in the future for another healthcare innovation webinar. This concludes today's program. Have a great day, everyone. Thank you.